put up here some screen grabs and some creative from a variety of online diabetes educational campaigns and programs that have launched recently. Considering your expertise, I've limited things to the online space, and I wanted to see which campaigns or support programs have you seen? Any of these, or it could be anything that you've seen.
I mean, I can tell by looking at them, that Lilly's got something to do with the one in the bottom left because I recognize their logo, and Levemir Novolog tells me where that came from, but other than that, I don't know.
Which of the programs have been effective in your online community? Why did you think they work, and why do you think they're successful? What is it about that, starting in the blogosphere that makes them, connect more and resonate more?
The ones that are more grassroots and sort of rooted in blogs and have connections back to single bloggers. I know more about those things. Once those people start something on their own and then find a connection with pharma, it's easier to track them and it's easier to trust it. But when it starts on the pharma end, it seems very branded and too shiny, maybe.
It tends to be ignored if it's just direct from pharma to us. At least that's what I've gathered from talking to a lot of people in the online diabetes community, that they tend to ignore the ones that are just direct, like commercials and stuff.
What are your most crucial channels for diabetes education? Are they websites of nonprofit health centers or organizations like the MayoClinic.org or diabetes.org? Are they pharma-backed product.com or non-branded microsites? Are they mainstream patient hubs like We Go Health? Or finally, are they diabetes-centered blogs?
So I think it would start with just diabetes-centered blogs for me. And from there, mainstream social media, because it still feels like it's just fed by individuals. After that, I would go to patient hubs like We Go. And then probably the non-branded microsites, and, lastly, the first option there.
I would agree pretty much with Scott's order, but one thing I wanted to point out, when it comes to education, I tend to go more towards patient hubs like We Go Health or Diabetes Daily or 2 Diabetes, because not only can you find forums there where you're speaking with other patients, but there's often links to other information that they find on the web, articles or studies, things like that. So to me, that's pretty important as far as an education point of view goes. I do definitely get a lot of information from other blogs or from Twitter, Facebook, and so on. But the reality that that's someone's opinion or someone's idea, and as Scott said earlier, everyone's diabetes is different. And so it's important to look at a variety of information and then glean what works best for you. So I do get a lot of information from blogs and Twitter and Facebook, but then I need to go and research it further myself.
I do the same thing where I read diabetes blogs, but I always go to medical journals or patient hubs, and then I even bounce information off my healthcare professionals.
When you identify that we're not involved as well as we should be in this aspect or that aspect or one of these things that I'm seeing here on the slide, you have to be careful when you come into it. You could end up making it feel corporate, and it sounds kind of harsh, but you might end up destroying a way that people connect to each other by over-branding it or trying to make it too sanitized. WeGo's doing a really good job with their website, but if it starts leaning the wrong way, it'll scare people away. It's no different than how they talk about Facebook was so great. One, it was kids, and then all of a sudden 30-year-old women started finding it, then your mom was on it, and then all of a sudden you get to that point where you don't want to listen to the same music that your parents listen to, so you move on to something else.